This 72-year-old woman has a 9-year history of progressive Parkinson's disease manifested by a large amplitude rest tremor in arms and legs, marked bradykinesia, slow and shuffling gait, retropulsion, and stooped posture. This 68-year-old woman has a 10-year history of progressive gait and balance difficulties, bradykinesia, dysarthria, and dysphagia. These symptoms are unresponsive to levodopa therapy. The complete ophthalmoplegia, retrocollis, and stridal hand deformities are typical features of PSP. This 6-year-old girl with a DNA-proven diagnosis of Huntington disease was well until age 3 when she began to regress in her mental and motor functioning. She developed progressive ataxia, chorea, and was no longer ambulatory by age 6. This 14-year-old girl with severe primary generalized dystonia and jaw opening dystonia failed to respond to conventional therapy. This 62-year-old man has a 12-year history of progressive chorea with documented family history of Huntington disease. Note the frequent use of voluntary movements such as touching face or adjusting glasses to camouflage the involuntary movements. This is referred to as parakinesia. This 60-year-old man first noted symptoms of Huntington disease about 10 years ago. In addition to chorea, he also exhibits mild but progressive dementia, pendulum reflexes, and halting gait characterized by irregular stride. This 59-year-old woman with Huntington's disease has a 7-year history of chorea, gait difficulty, and postural instability. She also has marked motor impersistence demonstrated by her inability to maintain tongue protrusion.
And Travis, I just want you to stick your tongue out and try to hold it out. Now hold it out as long as you can. Okay, now move the tongue to the right. Okay.
To the right, yeah.
This 52-year-old woman with Huntington's disease has a 5-year history of involuntary jerk-like movements that move randomly from one body part to another. This 32-year-old man has a 6-month history of generalized autosomal dominant dystonia involving chiefly his axial musculature and his hands. This 11-year-old girl has a 4-year history of fluctuating dystonia, being essentially normal in the morning and unable to ambulate in the evening because of generalized, predominantly leg dystonia.
He does have times that his face is still, but that if we can get the pain under control, he doesn't have these movements and grind.
This 14-year-old girl has a 1-year history of right hemidystonia, which later evolved into generalized dystonia. This 66-year-old woman with a 3-year history of progressive gait difficulty was initially diagnosed as Parkinson's disease, but in contrast to a shuffling gait, flexed knees, and en-bloc turning typically seen in patients with Parkinson's disease, this patient with PSP has the characteristic pivoting and knee extension, which helps to differentiate the two neurodegenerative disorders. This patient has task-specific dystonia manifested by involuntary right thumb extension.
First time he was placed on medication for his hyperactivity.
He was probably around 4 or 5 years old.
Okay, do you remember the first medication he was trying?
That was Thorazine.
Okay, Thorazine.
This 21-year-old man exhibits the characteristic features of tardive dystonia, including young age and opistotonic posturing with bilateral extension of the elbows.
This started, I would say, about 6, 8 months ago. And the blinking has picked up, I guess, in maybe the last 3 months.
Last 3 months. How does this interfere with your work?
Well, can you see someone saying, I drink this all the time and it's very good for you? I can't work.
You work mainly with commercials.
This college professor has a long-standing blepharospasm, complicated by severe dermatochalasis, for which he compensates by eyelid crutches.
Today is a nice day. Can you do that? Okay. And say ba 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 ba. And ta 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 ta. And ga 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 ga.
This 25-year-old man with Halle-Warden Spotts disease has a lifelong history of progressive tremors and generalized dystonia, anarthria, self-mutilating lip biting, and other clinical and neuroradiographic evidence of the disease.